Well, look, by virtue of being the chair of the steering committee for the summit program, I'd like to welcome you to this pancreatic cancer summit. A number of you would have been involved in the previous summit, and I just want to quickly go sort of through in terms of what we're trying to achieve here. Summit program is an initiative to try and improve outcomes for patients with cancer and their families. And what we focus on is identifying unwarranted variation in the treatment or the outcomes for patients. But we also want to engage the clinical leadership around the pancreas cancer treatment. Often doctors feel frustrated because they can't have a mechanism to try and improve the system. So here we're trying to assist clinicians to change practice and improve practice. And we have increasingly, with the Summit program, emphasized the importance of the consumer voice, which is a feature sort of across the system now. But I think particularly in these sorts of areas, we need to not only focus on improving outcomes for patients in a disease sense, but also outcomes in terms of their experience of care and support. And then we have the integrated cancer services networks across the state, which are a mechanism for coordination of implementation of initiatives that are identified here. Now, many of you would have taken part in the first Pancreatic Cancer Summit, which is now 2017, so 5 years ago. There were 70 clinicians and stakeholders attending at that summit. Since then, there have been a number of activities that have been undertaken in response to the original summit, and you'll hear more about those today. And today's summit will also present and compare the recent data to the previous summit data some 5 years ago. Also, we'll be, I think, identifying and discussing some additional variations that have come to light. And as I mentioned, in terms of bringing the experiences of patients to the summit also. We've got a different model in terms of the online model. We were essentially forced probably about 6 weeks ago to go with the online situation, not knowing quite how the current wave of COVID was going to play out. One of these days we'll be able to sit around the table face to face, which I think in the big picture is a much more effective way of running these kinds of events. But it's we have to just make do with what we can for now. But I really applaud the team who have put the summit, online summit together. It's not a small feat, and basically the experience of running the online summits has become very streamlined now. So we have some 90 clinicians and consumers participating today, and we're trying to, as much as possible, in the small group work, have a regional focus on what's important for the particular local areas. Just a brief comment in terms of the overall summit's experience. Identifying unwarranted variations and trying to prove the system is not a one-stop sort of event. It's an iterative process that needs to be ongoing, and it needs to be by the clinicians and the patients to try and keep the process going. It requires clinical judgment, but we have to start with very much the big picture in terms of looking at the whole state, not just the centres of excellence. And in terms of identifying what the priorities are for the state, and then focusing on coordination locally of acting on those issues is the model we're following. Briefly, next slide on there. Just briefly from previous summits, had for many years we had face-to-face meetings, but recently online meetings. Generally we have around 80 participants per summit. Generally, the feedback is that about 80% of patients would found it a very worthwhile experience, and up to between 85 and 100% of attendees would generally recommend a colleague to attend. We do recognise that the online summits is not quite the full experience, but hopefully we'll be able to get back to face-to-face sometime in the relatively near future. Briefly to thank the team who put this together, led by Janine Scott, who's the manager for the Tumour Summit program, along with Alira Mitchell, Sam Witcher, and Rebecca Miller, who does the communications work, and also, of course, Linda Nolte, who's the manager of NEMICS. So thank you very much, and handing back to you, Veronica.